Okay, so now I'm going to talk about what is available in distribution. These are all the basic supplies you can easily access from distribution if it's not on in your supply room on your supply cart. So we have the one-piece pouch, we have two-piece pouches, we have stoma powder, stoma paste, barrier rings. 2-inch is what we typically use. 4-inch we use for special occasions, for special needs. And then we have the large drainage bag for the urostomy. Now, an important distinction and difference that people often get confused is they grab a urostomy pouch when they really want a colostomy pouch. So note that you have a red stripe here, a blue stripe here. These colors are actually more about the size, but this is in general one way to tell the difference. But you can look at very small font. You have urostomy here, colostomy, ileostomy here. So, but that's hard to read, so I understand. So I often just say, look for the red one, look for the blue one. And these are the two-piece pouches. The two-piece pouches where the pouch and the skin barrier come apart. So the urostomy pouch, we only have a two-piece pouch, okay? These come apart. The important thing to remember about urostomy pouches is that their spout is of course different from the fecal pouch. So you're only draining urine. On here you have a small, what we call dribble cap, but that just protects the bottom of the spout to keep it clean. If you want to open it, then you just turn the spout 180 degrees so that you can see the water drop. That means it's open and flowing. Doesn't matter, it can go 180 any direction that you want. Okay, like that. It's a soft click, essentially, when it's closed. So, what if you want to connect it up to a large drainage bag, which is often what people do while they're in the hospital? So, you will have to get an adapter to connect to the large drainage bag, whichever one it is that you get. This is a basic one. Some of them have a hard plastic outer chamber. So you can find the adapter in the two-piece kit. So in the two-piece kit, you have the skin barrier, you have the pouch, in there is the measuring guide, but if you're looking for the adapter, here it is, right there, okay? What you do, let's see if I can pull that out. Okay, so it's just like this. It's a silicone connection. You just try to jam it on in there. You're not going to get it very far, maybe 1/3 of the way in or half if you're really strong, but don't expect to get it all the way down there, and then it's pretty tough. Okay, so to connect the tubing to the urostomy pouch, you want to open up the protective cap, and it just snaps in there like this. And then to detach, you just pinch and pull. I like to stabilize the pouch and then pinch and pull like that. And cover this with a glove and then cover that back up. And there you have it. An important thing to remember is that when you do have the pouch connected, once you reconnect it, you will need to open it up so that the water drop is, you can see the water drop like that. And then one thing you want to look for is then this tubing can twist up the pouch. You really need to have free flowing urine. So it's very important that this pouch is laying in a way that it is draining easily into the pouch, into the large drainage bag. So what I often have to do is I stabilize the pouch, and then I grab the tubing with the other hand and kind of twist as needed until it's laying nice and open.